did not get the things that she needed in order to thrive. But her teacher and her aides did their best. They went above and beyond every single day. They left school and brought things to my house and dropped them off on my porch. They laminated things. They did everything they could to come up with a curriculum to keep her moving forward and being challenged. And I so appreciate that. So I was so Are you ready? Yeah. Are you ready for us to be loud?
If it's quick. Okay, everybody who's speaking in the press conference, come on down, please. If you guys kind of just get behind it and comfort where you feel comfortable. We've got some teachers and parents and students to hear from for our press conference. So just show support by showing your signs and being in the shot. Well, as long as you're comfortable, so just keep a comfortable space.
Do your job. 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 Protect KCS! Protect KCS! Protect KCS! Protect KCS! Protect KCS! Protect KCS! Protect KCS!
All right, can you guys hear okay? All right, I'm State Representative Gloria Johnson. I'm not here to talk about me. I'm here to give a voice to the teachers and the parents and the students who need to be heard, who are, as the teachers tell me, sitting ducks in their classrooms right now. And so are the kids in their rooms. They're concerned about their students' families. They're concerned about themselves and their families. We've seen teachers die across the state, students, and we know how many people are in the hospital, a huge number of, and it's growing for students. So I want you to hear from the teachers and the parents and from the kids about what they're facing every day. The first person up is going to be Andrea Turner. She's a high school teacher.
Masks are inconvenient. They're unpleasant. I don't enjoy wearing one, and I certainly don't enjoy teaching in one. But the crisis unfolding before us is bigger than my personal discomfort. Last year, the highest active case count in Knox County schools was 277. On Monday, KCS reported 923 active cases. Doing nothing in response to this reality is not an option. During several board meetings last year, our superintendent expressed pride in our ability to offer in-person learning when other districts offered only virtual. He always cited the same reason for our ability to maintain this offering, our face covering requirement. All I'm asking tonight is that we keep the same energy. It's time to reinstate face covering requirements for all of our staff and students. We tried to start the year without it, and now hundreds of students are missing crucial days of instruction at the start of the school year. Over 100 teachers are as well, which compounds the number of students missing instruction, even if they're attending in person. And while learning loss is a political term with no basis in education research, I hear some express concerns about its effects, yet not lift a finger to stem the spread of COVID in our school this year. I'm here tonight because I love my students, and we need the board's help. We need their help to continue safely learning in person. I enforced the face covering policy last year. It wasn't always easy, but it was the right thing to do. In my experience, most students didn't appear to have near the problem with masks as some may assume. They understood they were being asked to make a small personal sacrifice for the greater good, and they accepted that. It's important to set aside fiery rhetoric and feelings to consider our common ground. On the most fundamental issue, we all agree. We want students safely learning in person. Right now, that's largely impossible. Teachers are covering each other's classes on planned periods every day. Every day, students come up to me privately and share fears about getting themselves sick or watching a vulnerable loved one become hospitalized because of what they carry home from school. Some of these students chose to learn virtually last year, and they feel betrayed by a school board that promised to follow public health guidelines as they evolved and failed to follow through. My students and I need the board's help because I can't do my job when they don't feel safe. No one can teach or learn well when they don't feel safe. Students can't learn well when they look around to see more empty desks every day and wonder, was I exposed? Are they okay? Who's next? Some defend a choice not to wear a mask because they enjoy good health, because they're unconcerned with COVID, because they don't want to. And this logic sits fine with me if the individual's the only one affected. What others choose to do in their personal lives is their business. My classroom environment is my business and my responsibility. And unfortunately, someone's choice not to wear a mask directly affects those around them and puts their health at risk. Please support my efforts to keep classrooms safe for all students. Not every child or teacher enjoys perfect health. When students enter my room, is my duty only to teach those who show up each day bright-eyed, eager, ready to learn? Is my duty only to teach those on grade level? Is my concern only for those who are academically healthy? Of course not. It's my moral and legal duty to ensure all students learn regardless of their barriers. My duty is to teach students with IEPs, to students with issues at home that leave them tired, scared, stressed, and anxious, to students who struggle with any number of mental or physical health issues. They are equally deserving of the least restrictive access to education. It's enshrined in federal law. We started the school year with disregard for their safety, and it's shameful. No plan is not working. We had a plan last year despite a few unavoidable hiccups. It worked. It was what was best for students. So I'm not asking anyone what their personal preference is. I'm not asking anyone what their political opinion is. I'm asking the board for help. Help me teach my students safely. Help me teach my students in person. Please require face coverings. Knox County Schools operates under a common mission to provide excellence and accessible learning opportunities that empower all students. That's all I'm asking for.
Thank you, Andrea. Next, we're going to hear a parent perspective from Kimberly Peterson.
I'm so glad that you all have come out, and I'm so glad to see such a strong support for our students. I have a 12-year-old 6th grade student who would be at West Valley Middle School this year, but instead she's at home with me. Now, this wasn't a personal choice. It was really a choice of life or death for my child. My child has a rare genetic syndrome. She's medically fragile, and even in the best years, she misses a lot of school for sickness. She gets hospitalized quite frequently for viruses, but in all the years that she's attended school, from the Cedar Bluff preschool program all the way through to North Shore last year, all of her teachers and aides and therapists and principals and staff were able to accommodate her needs, and she thrived in the classroom. She loves being in class. She's very social, and she gets all the things she needs there, her occupational, physical, and speech therapy, and they go above and beyond to really accommodate and tailor a curriculum for her. As school kind of came, as it was starting to begin this year, I was hopeful that we would put at least the same protections in place as we did last year, if not even some things that we had learned as we had dealt with COVID for over a year now. I think we got a false sense of security that this was all going to go away, and we all hoped it would, but as we see, you know, viruses don't play with our agenda. And that's the great thing about education, is that as you learn and you get new facts, you build upon the foundation every time. And I'm so disappointed that this Board of Education is not learning and growing as they are charged with doing for our students. They're sticking into the old ways, and they're wanting business as usual. And look at who's suffering. Our children. My child, who's at home with me, and I can't accommodate her needs. I can attend for her basic needs, but there's no online instruction for special education. My home doesn't have standards and specialized equipment that are needed for the kind of physical therapy she gets from professional trained therapists at school. You know, I hear a lot about rights. My child has rights too. Her rights are being denied right now. She's not able to go to school. She's not able to access the public education that is guaranteed to her. And all I want is for her to be back in the classroom. I'm asking that we wear a simple mask and do simple measures for the greater good. We do it every day. The kids do it. Children in my child's classroom previously had peanut allergies, and so no one brought peanuts to school. As much as my child might want a peanut butter and jelly sandwich, they sacrificed, and they didn't eat that peanut butter and jelly sandwich so that someone with peanut allergies wouldn't suffer. Where did that spirit of doing it for someone else and we're all in this together go? We've lost it, and I'm so disheartened and disappointed. I'm begging the Board of Education to do the right thing. Put simple measures in place that they committed to doing back in April. Allow us to space, to adequately clean and to mask, and to give us some time to get ahead of the curve. Just because we ignore it, it's not going to go away. And we need to get on top of this now. Please do the right thing.
Say and spell your name, ma'am, if you would.
Kimberly Peterson, Peterson.
And next up, we've got another teacher, Andrea Menendez.
Many of you listening here today already know the alarming statistics, graphs, and numbers that have made this press conference necessary. What you don't know are the faces and the names of people who are suffering on a daily basis. You don't know them because they're terrified to speak. My purpose here today is to give you a detailed picture of one teacher's day in a Knox County public school, in the hopes that other teachers will stand beside me and tell their stories as well. I only claim to speak for myself, however, my experience is not unique. Every morning, I arrive at school at 8 a.m. and drop my lunch and jacket off in my classroom. I say hello to my friends, then make my way to the library for my plan period. Most days around 8:25, I'll receive an email or text telling me I need to cover for another teacher who's tested positive or is awaiting results. This is not unusual, considering last week we averaged 20 teachers absent a day in our school with about 4 substitutes available. On the rare occasion I do have my entire plan period, I usually spend that time modifying the district-mandated curriculum so it will be compatible with the district-provided online platform. Although students have access to an electronic copy of our textbook, the platform does not allow students to easily save or turn in work through Canvas, where all asynchronous work is located. It takes about 45 minutes to make a version that is compatible and will allow students who are sick or quarantined to keep up with assignments. Very few teachers have the time to do this, especially when they are expected to cover other classes. At 10:07, I begin my second block class. I take attendance and note that only 50% of my students are present. This has been the case for over 2 weeks. And even though this is alarming, I know how lucky I am, because so many other teachers I know only have 25 to 30% of their students in class. Next, I open Teams. For anybody who is absent, I have about 1 to 2 students attend these virtual sessions. I want to be very clear that the reason more students do not attend is not because they are lazy or unmotivated. The majority of these students are so sick that they physically cannot sit up and look at a computer for 90 minutes at a time. Last year, we also dealt with extreme absences. But by and large, these students were quarantined, and thank you to the mask mandate, never ended up contracting the illness from their classmates. They were able to join our virtual Teams meetings and keep up with their work because they felt well enough to do so. I repeat this process for each of my 3 classes, all the while circulating the room to answer questions and running back to my desk to answer the constant stream of emails from concerned students and parents, letting me know of positive results and asking what they can do to keep up. The students who are lucky enough to have remained well ask me daily what's going to happen next. When will they know if they have been exposed? When will there be rules about masks? When will our classmates return? To each of these questions, I must either respond with, I don't know, or I'm not allowed to tell you. Last year we were frustrated and exhausted, but ultimately safe. I provided instruction that was quality and equitable. I could protect my students. We successfully taught in person for a majority of the year, and for that I'm so proud of this district. We made it work because our leadership was firm, consistent, and honest. This year, that is not the case. And it doesn't have to be that way. Knox County Schools knows what works. They've proven they can do it. Just like you, the parents, the students, the board members, I want to remain in person as much as possible. It's easier and it's more effective. But right now, we are hurtling towards collapse. And a single mask mandate could prevent further destruction to our community's health and our reputation as public educators. Thank you.
And next up, we have another, I think she's bringing another parent's voice, Amanda.
Say your name, ma'am, if you would, first.
Hi, my name is Amanda Gillen, and I am actually the single mom of 4 children who have gone and are in Knox County schools. However, today I want to speak with you for Jody Hood, who is a mother with 3 children in Knox County schools. Some of you may have seen her story on the news already. Jody was a nurse. She is a nurse for the last 10 years, and she worked in the ICU, working with COVID patients for years. And the second week of school, her 3rd grade daughter, who had masked and socially distanced for the previous 18 months, woke up and was sick. She called the school and wanted to know, has anybody in her class reported that they're sick? Do you know if anyone has COVID or reporting sick symptoms? The school told her that they do not track that. They're not allowed to tell her that. They did not know. Jody did what a mom and a nurse felt was the right thing because Knox County was not doing the right thing. She showed up and stood outside of the school with a poster board that read, "My child has COVID. Would you like to know if your child was in class with mine on Monday?" Simultaneously, we had decided as a few moms that we needed to start a Facebook group. It was clear that Knox County Schools was not going to go by what they voted to do, which was following state health department guidelines. And we thought, well, let's just try to, do contact tracing ourselves. We started the group, and within 8 hours had over 4,000 members who were coming on and self-reporting without saying their children's name and saying, my child tested positive, they are at this school, they are in this class. And we started seeing the trickle-down effect of all the children who were exposed and never knew and ended up with COVID. I will say that many teachers were also exposed and ended up with COVID. I will also say that her schools, Jody's schools, told her that Knox County Health Department would handle contact tracing and contact her. It's been 3 weeks. She has yet to receive a phone call. All 3 of her children are COVID positive now, despite the fact that she has been a nurse and working with COVID patients daily for 18 months and coming home and protecting her household. The difference? They were in our school systems. The school systems that physically chose not to follow the guidelines to protect our children and our staff members. This is absolutely infuriating to me. At this point, I'm not going to rely on Knox County Schools to protect our children. I'm going to put a plug in for our group because we have extremely effectively been able to do that. It is Knoxville Parents Against COVID. And if you are a teacher and afraid to report things, message me. I am more than happy to be your voice because your employer is clearly not doing it. Thank you.
Now for one of the most important voices we can hear from, and we Even though we're the Knox County School Board, a lot of times we're not listening to what our young people have to say. So we're going to hear young people voices. First up is Charlie Dorsett.
My name is Charlie and I'm a student at the Allen STEM Academy. As we all have seen, masks have been a controversial topic this year. When the CDC first released guidance stating people who have been vaccinated no longer have to wear a mask, it made me nervous. However, when I saw cases decrease at a steady rate and the guidance remained the same after I had my full vaccination, I made the decision to stop wearing my mask in outdoor, uncrowded areas where I could remain distanced from other people. Then a few weeks later, after I stopped wearing my mask, cases started to increase rapidly and the Delta variant surged. My first instinct was to put my mask back on to protect myself and my community. I am very disappointed that we are back where we were when cases were high several months ago. I was asked many questions why I chose to wear my mask even though I was vaccinated. My answer was always, I am wearing a mask because I feel obligated to protect others in my community and those who are at high risk. With cases rising and the vaccination rate being below half, I'm going to do what I can to protect my community. When school started on August 9th, students were texting each other asking who was going to wear a mask and deciding whether or not they should. For me, it was never a question. Wearing a mask does not harm me, and it does not harm anyone's learning ability in my classes. However, not wearing one puts students at risk for not being able to come to school for a full 14 days. And without the virtual option this year, while they are in quarantine, students can't learn and have the equal opportunities others do in the classroom. It has become apparent that we need a mask mandate in Knox County schools. The school board is about to meet to discuss this very issue, but right now, we need more than just masking. With only 83.8% of students at school yesterday, it has become apparent strict measures must be taken to keep students in the classroom and teachers teaching. To keep us, the students, in classrooms and learning to the best of our ability, and teachers teaching, masks need to be required within the schools. In an attempt to please Governor Bill Lee, members of the school board have proposed mask opt-outs as part of their motion. But the school board does not answer to the governor. The school board answers to the people. Masks should be required for everyone. Thank you.
Thank you.
Next up for our student voices is Marie Esserick.
Hi, I'm Marie. I'm a senior at Central High School, and today I want to talk about why I think we should wear masks in schools. First of all, masks are easy. They're not inconvenient. They're not that uncomfortable. They don't require extra teachers, extra space, extra software. They're convenient. They're also the most effective in preventing the spread of COVID as compared to sanitizing surfaces and social distancing. In my classroom, the desks are so close together that I can lean back and touch the head of the person behind me. I have 2 feet between each row of desks. In the hallways, it's literally a sea of people shoving past each other and breathing in each other's faces. Social distancing is not possible. I also heard that masks cause a lot of learning loss, and as someone who had an entire semester of online school, I will definitely say that there is no learning loss like being forced to be home instead of at school receiving instruction. There is also no learning loss like being sick, feeling like you're dead in bed because you cannot learn that way. Masks do not cause as much loss as that. Last week, my AP Calculus teacher unfortunately got COVID. It's out of his control, but he was out of school for a week. My class and I had to teach ourselves derivatives in AP Calculus, and we did not have a sub. We only had teachers, very stressed out, burnt out teachers coming in during their plan periods. So we were sitting there trying to learn. They were trying to prepare for their class. It's not functional, and it's a pattern that is repeating in every single classroom. I also want to emphasize that we do not want schools to be shut down. That is the main goal for us to be in school, but we want healthy kids in school. We do not want 1 in 7 students being out with COVID. We want a mask mandate, and we want students to be able to go to school without worrying if they've been exposed or if they're going to be in quarantine or if they're going to bring COVID home to their grandparents or their little siblings. My friends have told me multiple times that they can't even focus in class because they're too busy analyzing who's been coughing around them or who's been sick. One of my friends was denied a vaccine and a mask by her parents, and now she has every severe COVID symptom. Another one of my friends tested positive, and upon telling her school, she was told that she was exposed 5 times, and no one told her. I don't want to bring COVID home to my family. I don't want to bring COVID home to my grandfather, who I eat dinner with every single day. The most frustrating part is that I've been with Knox County Schools for 12 years. I've learned how to be reasonable. I've learned how to be compassionate. I've learned how to look to people who know more than I do and humble myself enough to learn from them. And now I'm watching adults who have had way more time than I had in 2nd grade to learn not follow those values. It's frustrating. It's hopeless. It feels like walking around with a bucket of water and the whole school is on fire and no one will help me pour it out. It's exhausting. And we are asking for a mask mandate. We're tired.
And the next student voice is Raymond Jen.
Hello, my name is Raymond Jen. I'm a senior at Fairgrove High School, and I'm also the student representative on the Knox County Board of Education. Of course, I want to first make it clear that my views, I do not represent the views of the Board of Education. However, I do hope that they take on some of my views. I'm also very glad to see so many people here out to support our students and do what is right for them. Our students' health and their education is of paramount importance. And our board, is supposed to be doing that. They have not been. We have seen students have to leave school because of COVID-19. We have seen teachers who have to leave classrooms for students to teach themselves because they cannot be here because of COVID-19. This is an issue that the board has not taken any action on, and they should. They should. We need a mask mandate so that everyone can stay safe, can stay in school, and properly learn so they can succeed in the future. Right now, we do not want to move back to virtual learning. At this pace, if we do not have masks and COVID continues to spread in our schools, that is exactly what is probably going to happen. I was completely virtual the entirety of my junior year last year. I knew so many friends who were also completely virtual last year. Yes, for some of us, education was fine, but for a lot of them, I know that they could not learn properly. They could not learn as well as they could when they were in person. We don't want that happening to all of our students in this county. If we want to keep them in person, then we have to do things to protect them. Right now, the simplest thing we can do is to offer a mask mandate. Our schools are nearly at full capacity. We cannot social distance. That is not a possibility right now. So the next thing we have to do is to mask. Mask up, have all students wear masks, protect not only themselves, but also protect the students and teachers and faculty around them. Thank you.
Okay, we happen to have a couple of folks here who would like to speak. One is doing everything they can to get folks vaccinated. So we want to hear from Cynthia about what you can do to get vaccinated.
Hello, my name is Cynthia Finch. They call me the vaccine lady. We stand ready to vaccinate anyone that has a desire to be vaccinated. I have schedules here. It's important to be vaccinated. We know that our 11 and below are not approved to be vaccinated yet, but we stand ready to vaccinate your child and your child and your child. So, if you would like to have information about being vaccinated, why it's so important, we have information. But let me say this to the Knox County School Board. If you're not going to do anything, one, we need a plan. Give us a plan. That plan needs to be about educating each and every one of our community people about how to keep themselves safe. This is personal to me. I've lost a family friend, a brother on a Monday, and another brother on a Wednesday. That is unacceptable. While we need to be a mask, yes, we need to have the mask on. That is the least we can do. So I'm encouraging our Knox County School Board to put a plan in place so we won't have to have our children to stay at home. Let's wear masks. That's the least we can do. Then we need to have an educational, aggressive educational process where we educate everyone in this community. Our leaders need to take action, and they need to take action today. Let's wear masks. Have everyone to wear masks. If you need information about where you can get vaccinated, I have the schedule. Tomorrow, we will be at the Boys and Girls Club on Irwin from 3 to 6. If you would like to get a vaccination, come to the Boys and Girls Club. But we have a whole schedule for the rest of the month of September. So if you would like to get a schedule, here's your one. Here's your one. So everybody can get vaccinated. Thank you so very much.
We've also got an emergency room physician who would like to speak.
Hello and good evening. My name is Dr. Jennifer Mozingo, and in all transparency, I'm not currently practicing emergency medicine. I'm actually practicing hospice, which has also been a challenge for us. And I was not on the original roster. This is the address I would have given to the board had I been able to. I'm a board-certified emergency physician for over 20 years. I am the parent of 2 vaccinated teenagers. They were some of the first in the county to be given that opportunity, and my son had a breakthrough case of COVID. As a practicing physician, infectious disease protocols and studying them are part of my training to identify patterns and minimize risk to patients and staff using a comprehensive understanding of biology and science. And it's a job I have taken seriously for more than 20 years of practice. As an elected official to the Board of Education, your job is to make decisions to ensure the safety and well-being of children and educators and staff, and to represent the interests of parents and students in academic and budgeting decisions. As we all know, not all of those decisions will be popular. And this is straight from the TSBA website. Tennessee school board members are elected by the community to make and to oversee critical decisions about the school district. Though the State Department of Education is the primary responsible agent for overseeing education in Tennessee, local school boards are charged with overseeing the governance of education within each district or school community. School boards work within the individual needs of their district, following guidelines and laws set forth by the federal and state governments, etc. And that's straight from their website. At a time when Tennessee has a nearly vertical epidemiological curve, which has now exceeded the peak case count from December of 2020, let me make sure I understand what the board is doing. And let us be clear, this Delta variant is not the previous Alpha variant that we were dealing with, and it has a much greater potential for exponential spread. So making your decisions on previous data is simply unscientific. Number 1, the previous policy was sunset in April when the pandemic temporarily receded. Number 2, this policy had allowed the superintendent the ability to institute recommended CDC or other health agency guidelines. Number 3, at that time, parents were under the impression that this would be revisited or reversed as necessary, with the expectation that if case counts increased, Knoxville County schools would likely revert to the previously successful safety protocols. Number 4, parents were also asked to decide at that time about virtual learning when the pandemic had temporarily receded, and are now being denied that option despite increasing prevalence and case counts. Number 5, no information is being provided to parents about their child's relative risk and exposure within your system. In the spring, there was adequate contact tracing. Now, parents have no idea if other students or teachers have exposed their children to this virus. In order to quarantine and protect their family member or extended family members, they are not given that information. KCS is simply doing the bare minimum in response to public outcry. From a public health perspective, the management of this issue, or lack thereof, is truly disturbing and reckless, which is baffling because it's really simple from a medical standpoint. We're talking about a population of children that equals all elementary students and over half of middle schoolers who are not eligible for a vaccine, and this is very important, not eligible for monoclonal antibody treatment if they become very sick, because it's not FDA approved for their age group. We repeat that, there is no treatment approved for them as well. So we have a vulnerable population with no approved vaccine, no approved treatment, no mitigation measures in place such as universal masking, and no information sharing concerning exposure and contact tracing. How is this okay for in-person instruction? This is at a time when the virus is rapidly spreading and we don't know the long-term effects of this virus in humans, especially children. Keeping children safe and giving parents accurate information in a transparent manner is the most important duty of the educational system right now. Because when they're in school, you are their guardians in our absence. Let me repeat that. When they are in school, you are their guardians in our absence. And the weight of that responsibility is not what is in question. Your motivation to your community is what is in question. Your allegiance to your community is what is in question. Your vision for our children is what is in question. Many parents are upset because this is the very definition of an abuse of power, where you control all of the variables with no recourse for the outcome. Many parents who felt powerless took it upon themselves to patchwork a contact tracing system of their own within social media and have reported backlash and censorship within those groups from those who are connected to the board. And they're concerned for teachers who are at risk and powerless. If our experienced educators are out to illness, what is the quality of the resulting education when you're having to rely so frequently on substitutes, which are now not available? I propose universal masking unless there's a very compelling medical reason not to wear one, to be in effect until vaccines are approved and widely administered to those children 5 and older. I also propose reinstating virtual learning for those who don't want to mask and they could stay home. I would propose a temporary closure for 2 weeks to lower potential transmission rates until this curve is bent. But what do I know? I'm not a board member. I'm just a concerned parent and a doctor who's trained to help sick people. Deliberately ignoring the recommendations of public health institutions constitutes complete negligence. As a medical professional, I'm held to a certain professional standard that I would be found negligent if I ignored guidelines and caused a negative patient outcome. When children are in close proximity, a layered approach to protection, which includes universal masking, will yield a safer result. Masks are uncomfortable, they may not be fun, and for those who would refer to the temporary discomfort of a mask as child abuse, you're just wrong. Talk to a DCS representative or a pediatric emergency room physician for help in clarifying what truly constitutes child abuse. I would also argue that there is no greater trauma than losing your sole guardian or caregiver or a loved family member to this disease because you were not adequately protected. And if you're a child, if you felt peer pressure not to wear a mask in school when your family thought that you actually were, and then had the virus affect your household, the guilt of that responsibility and loss would be unbearable. As children, as parents, we often tell our children there's no such thing as monsters, and if there were, we would always protect them. But as a fellow ER physician on Facebook said that when she lost her mother to this disease, COVID is a monster. This is merely asking for a temporizing measure to increase protection until a vaccine is approved in the 5 to 12 age group. A reasonable expectation would be this would be lifted once they are fully protected. Catering to a vocal, loud minority instead of supporting the silent majority is unconscionable and unwise, but as you can see, we're not silent anymore. You are public servants and took an oath as such, so just a word of advice. Be careful which horse you're betting on, because it's painfully clear that this race is far from over, and we are all watching for the finish line. And I'm going to end with a quote from Winston Churchill that says, "It is better to do something than to do nothing while waiting to do everything." Thank you.
That's it. If you want to talk to folks, they're still around. I don't think they're able to get in because of the limit. So if you have questions for anybody, they're available.